Hello guys, so welcome back. So today we shall be discussing another important topic that is called as Brucella, right? So we are discussing about Brucella now, right? So when you are discussing about Brucella, basically there are different types of Brucella, like Brucella abortus, Brucella melitensis, Brucella canis, Brucella suis and all, right? So we shall be discussing about the most important characteristics. We shall be discussing about the pathogenesis and later on how this brucella is going to affect you, what are the symptoms you're going to face if you are affected with this brucella, if you are infected with this brucella. So we shall be discussing all of that, right? So first thing, as I already told you, there are basically three different species of brucella, right? Within this brucella there are three different species. One is called as brucella abortus. One is called as Brucella abortus. The second one is called as Brucella canis, right? And third one is called as Brucella melitensis, right? So these are the three basic species of Brucella. So fine. What I'm going to tell you is that what happens when a person is affected with this Brucella. So all these three basic types of Brucella, they are prone to cause an infection that all of you know, that is called as brucellosis. That is called as brucellosis. So what type of infection you gonna get with the help of this brucella, right? If you are affected with this brucella, all of these three species, you are gonna get the common point, that is brucellosis. But the way you get abortus, the way you get infected with the canis, the route through which you get infected with the abortus, canis and melitensis is different. Okay, so what I'm exactly speaking, you'll get to know in a minute. But before that, we have to mainly concentrate on the general characteristics or general properties of the bacteria. So coming on with the general properties of the bacteria, right? So this topic is important for your MBBS exams. So pay attention. So what are the basic general properties of the bacteria which you see? The first important thing, every bacteria, whenever you discuss, you have to discuss few important things. That the first important thing, that whether it is a gram positive or a gram negative bacteria. So yes, this bacteria has got a thin peptidoglycan layer. So when I call it as thin peptidoglycan layer, you should know that it is gram negative bacteria. If a bacteria is having a thick peptidoglycan layer, it is called as gram positive bacteria, right? So this bacteria has got thin peptidoglycan layer. So this is a gram negative bacteria. Why? Because it has got a thin peptidoglycan layer. Thin peptidoglycan layer. So because of this thin peptidoglycan layer, you call this bacteria as gram negative bacteria, and it is a gram negative what? Coccobacilli. It is a gram negative coccobacilli. So this thing guys is very important. It is a gram negative coccobacilli. Second important thing. What is the second important thing which you need to know? Second important thing is, does this bacteria basically move? No, this bacteria do not have any kind of cilia, nor this bacteria has any kind of flagella. So it is a non-flagellated organism. It is a non-flagellated or non-ciliated organism. So when this bacteria does not have any kind of flagella or cilia, what will be the result guys? The result will be, it is non-motile. It cannot move. No flagella, no cilia. How do you think the bacteria is going to move? So it is non-motile bacteria. It is a non-motile bacteria. Third important thing which you need to focus is that this bacteria, where does it live? This bacteria lives within the cell. So can I call it as intracellular? Yes, this bacteria is intracellular, right? But scientists have also found one more thing. For example, let us say this is your host cell, right? And let us also tell that this is the bacteria over here. This is the bacteria. So bacteria is living within the cell. Bacteria is also living outside the cell. So it can survive intracellular, it can survive extracellular. So such bacteria are called as facultative intracellular bacteria. They are called as facultative intracellular bacteria. Facultative intracellular means bacteria lives within the cell and outside the cell. That is why we call it as facultative. If I call it as obligatory, then it should live within the cell. For example, look here, I'll make it clear. Another important property of this bacteria is an aerobe, right? What type of aerobe? It is an obligatory aerobe. It is an obligatory aerobe. What do you mean by obligatory aerobe? It definitely needs oxygen. Without oxygen, it will die. So that is the meaning of obligatory aerobe. Right. The next important property is that this bacteria do not form any spores. You know, in Clostridium, when we were discussing Clostridium, we came across Clostridium tetani, Clostridium perfringens, Clostridium botulinum, Clostridium difficile, right? So all the different types of Clostridial species. You can go back and watch through those lectures. So Clostridium, basically it releases spores. They are spore forming bacteria. What is the importance of spores? For example, let us say if there are Clostridial spores are very toxic. They can damage your nervous system. Spore is so minute that they can damage your nervous system. That is why those spores are called as neurotoxic spores. But here, this bacteria do not release any kind of spores. Now, don't think if it is not releasing any kind of spores, then I am safe. No, this bacteria has its own way of causing a disease. I will explain you in the pathogenesis. So, this bacteria is a non-spore forming bacteria. It is a non-spore forming bacteria. It is a non-spore forming bacteria. Another two important things which you need to know is that this bacteria, right, it does one reaction, guys. So let me draw the bacteria first and explain you what reaction does it do. Let us say that this is a bacteria over here. This is a bacteria, right? So this bacteria releases a specific enzyme, and the name of that enzyme is urease. The name of that enzyme is urease. And what does urease do is, urease basically converts urea all the way into ammonia plus carbon dioxide. Okay. So if a bacteria is releasing urease, such organisms are called as urease positive organisms. What are they called? They are called urease positive organisms. If a bacteria is not releasing urease, you know the answer, it is called as urease negative organisms, right? Another important thing, okay, why are you telling about this? What is the importance of this urease? If it is releasing, so what? The important thing is that, for example, let us say the property of urease positivity or urease negativity has a great importance in the diagnostics. It has a great diagnostic importance. Why? For example, let us say all of you know that gastric ulcers, right? Gastritis is caused by basically type B gastritis. There are different types of gastritis, type A, type B, type C, right? Type B gastritis is caused by a bacteria that is called H. pylori, Helicobacter pylori. So how am I going to find Helicobacter pylori? Because Helicobacter pylori enters into my stomach and it will damage my epithelium and it will cause the ulcer. But how will I know? Will I put an endoscope inside and microscope along with that and zoom it and see the bacteria? No. How I'm going to know that bacteria is that I'm going to give the patient a glass full of urea. I'll tell him to drink. Now he will drink the urea. After drinking the urea is right now located in his stomach, right? So just for an example, this is the stomach of the patient, right? So in this patient, what did I give him? I have given him urea. Okay, what did I give? I have given him urea. Now after giving urea, what will happen is that, for example, let us say this is the H. pylori bacteria. This is H. pylori bacteria. So basically H. pylori bacteria releases urease. You know, H. pylori bacteria releases urease. So this H. pylori bacteria releases an enzyme urease. So when it releases urease, you are taking urea from outside. So from outside, whatever urea you are taking, this urea gets converted into ammonia plus carbon dioxide. Fine. So how am I going to find it? Anyways, how are you going to find it is that you are not going to store the carbon dioxide in your body. So obviously you will exhale the carbon dioxide out through your system, right? Out through your respiratory system. So the amount of carbon dioxide which you exhaled, doctors are going to check that. If there is more amount of carbon dioxide that is exhaled than the normal, then it means there is bacteria sitting right there in your stomach. So it means it has got a great clinical importance, right? So this test is called as urease breath test, right? And it is a gold standard test to identify the gastric ulcers, right? So it is called as urease breath test. So these things you learn in your fourth year, right? So fourth or the final year when you have the internal medicine, okay, the medicine class. But anyways, next important thing is that not only that, urease has also got another clinical importance. You know what is that? Can anyone tell what is that? Look here. Let us say this is the female reproductive system which I am drawing. This is just a rough picture of the female reproductive system. A rough picture, right? So there are some organisms, guys. These organisms, they all the time stay in the female genital tract. Okay, I'm not telling you the name of the organisms. You better go back and watch my lectures what those organisms are, and please comment down what organism I'm talking about. Okay, so there are some organisms that are located in the female genital tract. Now you might think that how are these organisms living there? Because female genital tract, right, the urine there is highly acidic. So when it is highly acidic, no bacteria can survive there because the pH there is too low for a bacteria to survive. It is not a favorable condition for a bacteria to survive. But still, how is a bacteria staying there? The reason is, guys, these organisms are urease positive organisms. What do I mean is, these organisms release an enzyme called urease. And you know what this urease will do? All of you know, urease converts urea into ammonia plus carbon dioxide. What is this ammonia now? What is this ammonia? Yes, ammonia is an acid or alkali? Ammonia is an alkali. So there will be a lot of ammonia within the female genital tract. It means now the female genital tract has turned from an acidic environment to alkaline environment. So obviously bacteria can stay in alkaline environment. So this is how the bacteria makes that entire region, the entire female reproductive system more favorable to itself, and slowly the bacteria starts dividing and it will cause multiple infections to the female genital tract like vaginitis, cervicitis, endometritis, right? So these are the two most important things you have to know in microbiology. Why an organism, if it is urease positive, what happens? Right? Why are you discussing about urease positive organisms? What is the importance of urease positive organisms? Right. The next important thing is that not only that, guys, it is also catalase positive. It is also catalase positive. Now, what do I mean by catalase positivity? Right, again, if you are the one who are watching this lecture for the first time, you have to know it because I've spoke it enough in the previous lectures. So you can skip for those who have already know what I'm talking about. For example, this is a blood vessel, right? So in this blood vessel, all of you very well know, this blood vessel has got endothelium in it. So these are your endothelial cells located within the blood vessel, right? Now, before that, I want to tell you one thing. Some bacteria, right? Some of the bacteria, let us say this is one of the bacteria, okay? Some random bacteria. This bacteria released an enzyme called catalase. And what does this catalase do is that this catalase will convert H2O2, which is also called as hydrogen peroxide, into water plus half mole of oxygen. So water and half mole of oxygen, together you call this item as foam. That is the reason why when, for example, I have any kind of superficial cut wounds, right? So you add hydrogen peroxide. When you add hydrogen peroxide, you see the foam coming out of that. That foam is nothing but consisting of water and half mole of oxygen. So what is my main intention to teach this reaction is that never ever add hydrogen peroxide to deep cut wounds. For example, if I have got a cut of my radial artery, ulnar artery or femoral artery or any kind of deep arteries, if you are adding hydrogen peroxide, you know what will happen? Look here. This artery which I have drawn here, this is a deep artery for example. I have got a cut of this artery here. When I got a cut of this artery, all of you know very well that now the blood comes out, the blood oozes out of this artery. The blood oozes out of this artery. But another thing, if you can very clearly see, the endothelial cells are also ruptured, the endothelial cells are also damaged. From these damaged endothelial cells, you have a release of an enzyme called catalase. Okay, and what is this catalase going to do? All of you know now, catalase will convert hydrogen peroxide all the way to water and half mole of oxygen. So you find multiple oxygen molecules within this deep artery. When you are finding multiple oxygen molecules within this deep artery, all these oxygen molecules, they join together to form a very big oxygen bubble, right? Air bubble. And this patient gonna have air embolism. So the patient will die of air embolism, right? So immediately the patient will die of air embolism. So what are the important things you need to remember? Never ever add hydrogen peroxide to deep cut wounds because it will lead to air embolism, right? So this is an important thing to understand. Right. Now this catalase enzyme, if a bacteria is releasing catalase enzyme, you call it as a catalase positive organism. So that is the reason why I have called this organism as catalase positive and urease positive respectively. So we basically discuss all these 7 things in every lecture. So right, let us enter into the next part, that okay fine, you are talking about Brucella. You told me that Brucella causes brucellosis. Can you tell me how does it cause brucellosis? Can you tell me how, first of all, how that bacteria is entering into your bloodstream? How is it entering? So what is the transmission? Can you explain the transmission of this bacteria? How this bacteria is getting transmitted into your body? How is it getting transmitted is by basic 2 ways, guys. So you have to basically know how this transmission is occurring. Transmission occurs by 2 different ways, guys. It occurs by 2 different ways. What are these 2 different ways? For example, I am in the, let us say, cattle field, right? So I am in the field, there are many different types of animals. So each animal can cause different type of brucellosis to me. What do I mean is, let me put up a heading there. Let me put up one small heading. What I am trying to tell is, you can transmit Brucella or you can get infected with the Brucella when you have direct contact with what? Direct contact with infected animal. If you have direct contact with infected animal. So in case of direct contact with this infected animal, you might contract means you might basically get this Brucella, right? Can you tell me what animals causes brucellosis? Okay, the first thing, for example, if you come in direct contact with the cattle, then you are more likely to get that type of Brucella infection which is caused by Brucella abortus. For example, if you are in direct contact with the infected goat or sheep, then you are more likely to get that type of Brucella infection which is called as Brucella melitensis. Okay. Next, for example, if you are in direct contact with the dogs, or if you are direct contact with, let us say, rodents. All of you know what are rodents, right? So in this case, you are going to be infected by that type of Brucella which is called as Brucella canis and Brucella suis respectively, right? So these are some of the important things. Why I have written this? Because it will be important for your MBBS exams and also to solve the MCQ, right? To solve the MCQs, right? How a next group of people are infected? The next group of people are infected by ingestion of contaminated animal products. Ingestion of contaminated animal products. What do you mean by this? What do I mean by this is that, for example, if I am ingesting contaminated animal products, for example, contaminated eggs, contaminated dairy, contaminated, I mean the milk and all these are contaminated with this bacteria, because these bacteria is coming from the cattle only. So if that infected cattle is giving us the milk, or let us say giving us the eggs and all, eggs, meat or whatever it is, so if I am ingesting that products from that contaminated animal, then I am more likely to get this brucella, right? Clear? So two ways of transmission: either if you are in direct contact with the animal. See, I have got a cut in my skin, I am working in the field, I got a cut in my skin, and that very time I got a contact with an infected animal. So bacteria from that animal will directly enter through my cut skin into my blood vessel. So once bacteria enters into my blood vessel, what is going to happen? Look here now. It means now we are slowly switching on to the which part, guys? We are slowly switching on to the pathogenesis. Pathogenesis. Right. What I was trying to tell you. For example, let us say this is your blood vessel. This is your blood vessel, guys. Okay. Normally, if any bacteria enters into my body, for example, this is a cut surface, right? And okay, to exactly locate that, you have got your endothelial cells like this. Some endothelial cells are ruptured here, you see. Why? Because these endothelial cells are cut. So through this cut surface, and the other end, the endothelial cells are fine. So through this cut surface, the bacteria is entering into your body. Let me draw the bacteria with a green color. Okay. So bacteria is entering into your body. So bacteria has entered into your body. This is Brucella. This is Brucella bacteria, whatever it can be. Brucella abortus, melitensis, right? Brucella suis, whatever bacteria it might be, it entered into your body. So when it entered, immediately there are some cells to engulf this. What are they? Very good. They are your macrophages. So you see, macrophages are waiting there. Now macrophages will engulf them by a process called endocytosis. After engulfing them, how does a macrophage look? Let us say this is the macrophage, and this macrophage has engulfed this bacteria. Now the bacteria is inside here. Engulfed this bacteria and kept it in a vesicle, right? Now all of you should tell me the name of this vesicle. What is this vesicle? This is called as phagosome. This vesicle is called as phagosome. Now, there are some special naughty things that are present right now in your macrophage. That is your lysosome. So, you see, these are your lysosomes. Okay, so what are you trying to teach us exactly? What am I trying to teach you is, let me elongate this blood vessel, right? So, what am I trying to teach you is that this lysosome fuses with the phagosome, right? So this is your lysosome, this is your lysosome, this lysosome fuses with the phagosome. So when it fuses with the phagosome, look how is it fusing. So this is your lysosome, right? Now this lysosome moves all the way, and finally it starts fusing with the phagosome. Now once it fuses with the phagosome, how does the picture look? Lysosome has fused with the phagosome, and now the resultant product which is formed, this is called as phagolysosome, right? This product is called as phagolysosome. This product which is formed right now, this is called as phagolysosome. So what will happen? This lysosome will release enzymes within this phagolysosome. The lysosome is going to release some enzymes, and all of you know what are those enzymes? Hydrolytic enzymes. The phagolysosome, the lysosome will release enzymes called as hydrolytic enzymes. And what are these hydrolytic enzymes going to do? Obviously, these hydrolytic enzymes will kill the bacteria. These hydrolytic enzymes will kill down your bacteria. Clear? This happens normally in you and me whenever any kind of bacteria enters into the body. But in case of Brucella, the situation is completely different. What do I mean by that? After knowing the normal thing, now let me teach you the abnormal thing that is happening in your body. It is very, very interesting. Look here now. Let us say this is your blood vessel, right? This is your blood vessel. Now, let me also draw few important things like, endothelial cells are very important. So, from now, whenever I tell endothelial cells, you should not think. You just have to tell endothelial cells are the lining of the blood vessel, right? In fact, some of them don't know because I came across those students anyways. So, right, this is your blood vessel basically, I think, right? Yeah. So whenever you got a cut of the blood vessel, like this, right? So this the edges will be staggered like this, right? Staggered edges. Now the real culprit. What is the real culprit? The real culprit is your bacteria. What is this bacteria, guys? This is your Brucella. Obviously, this bacteria is your Brucella. Brucella has entered now. If you very closely look to the structure of Brucella, okay, before that, let me tell you one thing. Whenever the bacteria has entered here, what will come and phagocytose it? Yes, obviously lysosome, not lysosomes, obviously macrophages. So your macrophages are ready to engulf this, but macrophages will not engulf. You know why? The reason why these macrophages will not engulf this bacteria. Let me draw the this macrophage little big. The reason is, if you very closely look into this Brucella, look here, this is the Brucella, right? Now on the surface of the Brucella, you have got some molecules like this. You see, how are these molecules? These molecules are like injections, right? Injection like molecules. So you have got some injection like molecules here. These injection like molecules will make holes in this macrophage. After making holes in this macrophage, what is it going to do is, within the bacteria, inside the bacteria, you have got very deadly proteins. You see, I am drawing small red colored dots. These red colored dots are representing some very deadly proteins. These are called as effector proteins. What are these proteins called as? These are called as effector proteins. So what are these effector proteins going to do? This bacteria, with the help of that injection, it will release the effector proteins into the macrophage. After releasing into the macrophage, what is going to happen? What is going to happen is that, every macrophage has got its own DNA, right? Every macrophage has got its own DNA like this, right? Now DNA will be converted into what? Obviously the DNA material on the DNA will be transcribed on mRNA, and finally mRNA helps in protein synthesis. Now these effector proteins will inhibit protein synthesis. What is the function of these effector proteins, guys? These effector proteins will inhibit the protein synthesis. Inhibit protein synthesis. Will inhibit the protein synthesis. When protein synthesis is inhibited, macrophage cannot synthesize proteins. So what will happen? Macrophage will die. So there will be a death of the cell, apoptosis of the cell, or necrosis of the cell, right? But some of the macrophages are very intelligent. You know what do they do? Look here, what do they do? What do they do is that, for example, this is a Brucella over here, right? This is a Brucella. Now Brucella is having an injection like molecule here anteriorly, right? Now this macrophage, you know what it is going to do? Look here. You know this macrophage, what it is going to do? Look here. This macrophage will come from the back. This macrophage is coming from the back and completely it will engulf it, because on the back there is no protein like this, no injection like molecule. And by the way, I forgot to tell you the name of this injection like molecule. This molecule name is called as injectosome. This is called as injectosome, or the other name for this injectosome is T4SS. What does T4SS stand for? T4SS stands for type 4 secretory system, because it is secreting those effector molecules. Okay, so it will engulf it. Once it has engulfed that, how will the picture look, guys? Now tell me, how will the picture look once it has been engulfed? So now this is the macrophage. Within this macrophage you have your beautiful phagosome, and within that phagosome you have this bacteria. Right, now finally bacteria entered into the phagosome. Bacteria entered into the macrophage. After entering, what is the second step? Previously I told you that lysosomes will go and fuse with the phagosome and release hydrolytic enzymes and damage them, right? But look here what is happening in this case. In this case also, these are the lysosomes, right? These lysosomes wander all the way like this, all the way, and try to fuse with that. Try to fuse with the phagosome. Even if it is trying to fuse with the phagosome, it cannot fuse with the phagosome. Why? What is happening here? What is happening is this bacteria here releases a special toxin. Okay, what is that toxin? That toxin is called as non-endotoxic lipopolysaccharide. So it releases a special toxin like this. And you know what this toxin will do? What this toxin will do is, if any lysosome is coming near, it will stop that lysosome from attaching with the phagosome. Because you know, if it will attach with the phagosome, it will release hydrolytic enzymes and the work is done. The bacteria is going to die. So very technically, very logically, this bacteria releases these black color molecules. These black color molecules which I have mentioned here, right? So these black color molecules over here, these are called as, what did I name them previously? These are called as non-endotoxic lipopolysaccharide. They are called as non-endotoxic lipopolysaccharide molecules. Non-endotoxic lipopolysaccharide molecules. Right? So, non-endotoxic lipopolysaccharide molecules, it is an MCQ. What is the function? They prevent the formation of phagolysosome. Right? So, what do? They prevent formation of phagolysosome. They prevent the formation of phagolysosome. So this is an important thing which everyone has to definitely know. Clear so far? Right. So now what is going to happen? What is going to happen is that lysosomes cannot fuse that. Now when lysosome cannot fuse, now phagolysosome is not formed and the bacteria cannot be killed. Now this is the best time for the bacteria to show its activity. You know what does bacteria do? Now bacteria starts dividing. Okay. So what happens with the bacteria is, I am rubbing all of this. Now what happens with the bacteria is, now slowly within this macrophage, the bacteria starts dividing. You see here how this bacteria is dividing. So this bacteria starts dividing. So there are multiple bacteria that are formed. Okay, because this phagosome cannot do anything. Now this bacteria keeps on dividing. Now once this bacteria divides enough, there is no space to divide more in the macrophage, right? So it cannot divide more. So when it cannot divide more, what will happen is that the macrophage will bulge out, and finally the macrophage is broken like this. The macrophage tears out. There is burst of the macrophage. So when the macrophage bursts out, what is going to happen? All of you know, when the macrophage bursts out, all the bacteria is released into the blood. When the macrophage bursts out, all the bacteria is released into the blood. And this condition, guys, this condition where all the bacteria is released into the blood, that is called as bacteremia. Bacteremia. Right? You know, not only the bacteria is within the blood system now, within the vascular system. Additional thing, you know what is going to happen? Let me continue this blood vessel here. What I'm doing is I'm just continuing the blood vessel here so that you would understand it better. I'm just continuing the blood vessel here. So what is happening? What is happening is that a lot of bacteria is released, right? So all these bacteria here, guys, what is happening now? Look here. All this bacteria will move all the way in the blood like this, and that condition you call it as bacteremia. Right now the bacteria is wandering in the blood. Now when the bacteria is wandering in the blood, what is going to happen? What is going to happen is that whenever the macrophage is dead, or whenever the macrophage is broken, or whenever the macrophage feels that there is something odd things going on in the body, macrophage immediately releases two important things, two important cytokines. One is called as interleukin 1 and the next one is called as interleukin 8. So obviously this macrophage also releases two important cytokines, right? So what are these cytokines that are released by this macrophage? One is called as interleukin 1 and the next one is called as interleukin 8. Now can anyone guess what are the functions of interleukin 1 and interleukin 8, guys? Interleukin 1 is responsible to cause fever. That is why whenever there is bacteria in your body, you have fever. And interleukin 8 is responsible to cause inflammation. Right? So two important things. One is the fever part and the other one is the inflammatory part. So these are happening because of our immune cells, right? The macrophages. So in this way, your macrophages are alerting you that there is something bad going on. You see, you have fever, you have excess inflammation. Now go to the hospital, get some antibiotics, right? Okay, fine. So how long this bacteria will travel? Obviously, I have just shown you the picture of single macrophage. Think there are thousands of macrophages releasing thousands and thousands of bacteria. You know what is going to happen? Let me continue the blood vessel still down there and explain you what will happen. What I'm doing is, guys, I'm just continuing the blood vessel down. So let me continue this blood vessel down over here. I'm just continuing the blood vessel down. Now look what is going to happen. And by the way, don't confuse this. Obviously, if I don't draw endothelial cells, you cannot confuse that this is not a blood vessel. This is a blood vessel having blood and your favorite bacillus bacteria over here. So now this Brucella bacteria, which is a gram-negative coccobacilli, what does it do? One side it made the macrophages to cause fever and inflammation. Now look what is happening on the other side. Other side, what is happening is this blood vessel, right? You know, there are arterial supply to your brain, right? So you have blood vessels supplying to your brain. So this is your brain, for example, supplying to your central nervous system. You even have let us say blood vessels that are supplying to, for example, your lymph nodes. Let me draw the lymph nodes simple. So these are the two lymph nodes, for example. You even have blood supply to what? To your liver as well as spleen. You even have blood supply to your liver as well as spleen. Now look what is going to happen. So when the bacteria all the way goes like this, and enters into your brain, it will cause a condition, and that condition is called as encephalopathy. That condition is called as encephalopathy. That condition is called encephalopathy. If the bacteria enters into the lymph nodes, or if the bacteria enters into the liver as well as the spleen, what is going to happen? Yes, tell me. If the bacteria enters into the lymph nodes, obviously your lymph nodes will be affected. There will be swollen lymph nodes, and that condition you call it as lymphadenopathy. Lymphadenopathy. Okay, for example, if the bacteria enters into your liver as well as spleen, so both of them gonna be inflamed, and that will cause hepatosplenomegaly. That will cause hepatosplenomegaly. And what is that going to cause, guys? That is going to cause hepatosplenomegaly. And on the other hand, you have got lymphadenopathy, and finally you have got encephalopathy. So can I list out, guys? It will be very easy for you. What are the conditions that are associated? The first condition that is associated, all of you know, that is, yes, encephalopathy. Encephalopathy. The second condition that is associated is hepatosplenomegaly. Hepatosplenomegaly. The third condition that is associated is lymphadenopathy. The third condition that is associated is lymphadenopathy. Not only lymphadenopathy, guys, you even have fever as well as inflammation, right? So you even have fever, you even have inflammation. And why do you have fever and inflammation? Because of your macrophages, right? So you even have fever and inflammation. Fifth important thing, when the bacteria is too much, it will cause too much release of interleukin 1 and interleukin. For example, if the bacteria is too much, it will cause excess release of interleukin 1 and interleukin 8, and that will cause severe inflammation in the body, and this condition you call it as sepsis. Patient can also have sepsis. So these are the basic conditions that are associated with this bacteria, which everyone have to know. These are the basic associated conditions that everyone has to know. So this is the basic pathophysiology of how this bacteria basically affects your body. Multi-system organ dysfunction, right? So what are the symptoms? So I told you that patient is gonna have fever, right? I told you that patient is gonna have fever. Can anyone tell what is the characteristic fever which you see in case of Brucella? The characteristic fever which is associated with the help of Brucella is undulating fever. That is undulating fever. You know what is undulating fever? Undulating fever is the fever increases and again falls. Again the temperature increases, again the temperature falls. So it is like a wavy pattern. This is called as undulating fever. Apart from undulating, and by the way, undulating fever is the most common symptom which you see and characteristic one. Apart from that, obviously, you know, when the patient is having sepsis, inflammation and all these things going on, you know, patient will have what? Malaise. Patient will have vomiting. Not only malaise and vomiting, patient will also have nausea and headaches. So these are the basic things which everyone have to know for your MBBS exams regarding the Brucella. Thank you so much for watching this video.